We are pleased to welcome Dr. Elham Sadat Afraz from Iran. Her presentation is titled Enhancing Diabetic Wound Healing, the Therapeutic Potential of Gelatin Hydrogel in an Animal Model. This presentation will explore innovative biomatter-based approaches to improving wound healing in diabetic condition. Please enjoy her presentation.
Today, I am excited to share a portion of our research titled Enhancing Diabetic Wound Healing, the Therapeutic Potential of Gelatin Hydrogel. This work is a part of a broader study that explores the healing effects of the decellularized human placenta and gelatin hydrogel on diabetic wounds in animal models. As we all know, chronic wounds are one of the most common and severe complications of diabetes mellitus. These wounds, unfortunately, tend to heal slowly, and this delayed healing is mainly due to factors such as poor blood circulation, nerve damage, and a compromised immune response. As a result, diabetic wounds are highly prone to infection and in some extreme cases may lead to amputation. This not only has a devastating impact on the quality of life for patients, but also creates a significant burden on the healthcare system, contributing to rising medical costs. The challenge of treating diabetic wounds has been a persistent issue in clinical practice. As a medical community, we have seen a growing need for more effective and innovative solutions that can significantly improve the healing process. This research aims to contribute to the development of such solutions, focusing on novel treatments that could help manage these chronic wounds more effectively. One such potential solution is the use of hydrogel that are soft water-containing biomaterials that create a moist and optimal environment for wound healing. This moist environment helps in reducing pain, promotes the tissue repair, and support oxygen flow to the wound. Among various types of hydrogel, gelatin-based hydrogels have shown great promise. These hydrogels made from gelatin provide an excellent foundation for enhancing wound healing, especially in chronic cases like diabetic wounds. Gelatin itself is derived from collagen, which is a major natural component of the skin. This makes gelatin highly biocompatible and safe to use for medical applications. Furthermore, gelatin biodegrades naturally, posing minimal risk to the body. Most importantly, it has the ability to mimic the extracellular matrix essential for cell growth and tissue regeneration, which plays a critical role in wound healing. This unique combination of properties makes gelatin hydrogel an ideal candidate for treating chronic wounds, particularly in diabetic patients. In our study, we aim to assess the therapeutic effects of gelatin hydrogel on wound healing in diabetic rats. Specifically, we wanted to determine whether this material could accelerate the healing process and provide a viable low-cost treatment option for chronic wounds in diabetic patients. Now, let me take you through the methods and material we used in the study. We conducted an experimental study using male rats, and diabetes was induced in them through the injection of streptozotocin. This chemical damaged the insulin-producing cells in the pancreas, effectively mimicking the diabetic condition seen in humans. Once the rats achieved stable diabetic conditions, we proceeded to create full-thickness skin wounds on the back of each rat to simulate a chronic wound. Please note that cutaneous wounds can be induced in various regions of the dorsal surface. For example, in the figure shown, the wound is located on the upper back near the neck. However, to standardize the wound location and facilitate comparison between groups, we selected the mid-dorsal area and created symmetrical wounds arranged in two parallel rows. After creating the wounds, the rats were divided into two groups. The first group was the control group, which received no treatment. The second group was the treatment group, where gelatin hydrogel was applied directly to the wounds. This setup allowed us to compare the healing process in the two groups, with one receiving the hydrogel treatment and the other receiving no intervention. We tracked the healing progress at 4 different time points: day 0 before treatment, day 7, day 14, and day 21. To monitor the wound area, we used high-quality photographs and analyzed them using ImageJ software, which provided precise and quantitative data. This method gave us an objective way to measure and compare the healing progress between the two groups. Additionally, we monitored other clinical signs of healing, such as skin closure and inflammation. Here, as you can see in the graph, the results were quite revealing. By day 7, the group treated with gelatin hydrogel showed significantly smaller wound area with a p-value below 0.01, indicating a statistical significance. The trend of accelerated healing continued through day 14. By day 21, most of the wounds in both groups were nearly closed. However, the treatment group reached this stage much earlier, which clearly shows hydrogel's effectiveness in speeding up the wound healing process. The images here provide a clearer picture of the healing process. As you can see, the wounds treated with gelatin hydrogel exhibited faster shrinkage and earlier formation of healthier and smoother tissue. The graph further highlights the wound area reduction over time, especially in the early and middle stage of healing, where the hydrogel was most effective. In conclusion, our study demonstrates that gelatin hydrogel significantly accelerates the wound healing process in diabetic animal models. It plays a crucial role in tissue regeneration, particularly in the earliest stage of recovery. These findings suggest that gelatin hydrogel could be highly promising treatment for chronic wounds, offering both medical and economic benefits, especially in the management of diabetic wounds. We believe that the findings from this research could open new avenues for developing affordable, effective wound care solutions. This could greatly benefit diabetic patients who suffer from chronic wounds and significantly reduce healthcare costs in the long run. By incorporating gelatin hydrogel into standard wound care practice, we could see improved outcomes for patients, faster healing, and a reduction in complications such as infection and amputation. Thank you all once again for your time and attention.